Good morning, and thank you for watching our slideshow on ventricular septal defects. This is brought to you by Brandon Williams, Catherine Cedarland, Daniel Clampett, Arnett Carr, and Gerzimam Jagdal. We are LVN students for Gurnick Academy of Medical Arts in Modesto, California, and we are VN-55 Mod 4 students. Ventricular septal defects, or VSDs, is a hole in the heart, is a common heart defect present at birth. On the left side, you'll see a normal heart. On the right side, you'll see a heart with a VSD, which shows a hole there in the septum of the heart, allowing blood to flow freely between the right and left ventricles. The hole occurs in the wall that separates the heart's lower chambers and allows blood flow to pass from the right to left side. The oxygen-rich blood then gets pumped back into the lungs instead of out to the whole body, causing the heart to work harder. A small ventricular septal defect may cause no problems at all, and many small VSDs close on their own. Medium to large VSDs may need surgical repair early on in life to prevent complications. Signs and symptoms of a serious heart defect often occur during the first few days, weeks, and months of a child's life. VSD symptoms in a baby may include poor eating, failure to thrive, fast breathing or breathlessness, and easy tiring. Symptoms in a baby may also include abnormal heartbeat, fast breathing, poor growth, and trouble eating. And man, does this little baby not look very happy at all. In older children and adults, symptoms may include fatigue, heart palpitations, inability to exercise, shortness of breath, and stroke. You and your doctor may not notice the signs of ventricular septal defect at birth. If the defect is small, symptoms may not appear until later on in childhood, or they may not at all. Signs and symptoms vary depending on the size of the hole. Your doctor may first suspect a heart defect during a regular checkup, where he hears a murmur with a stethoscope. Sometimes VSDs can also be detected with an ultrasound before the baby is born. When it's time to see a doctor, when your baby or child tires easily when eating or playing, is not gaining weight, becomes breathless when eating or crying, breathes rapidly, or is short of breath often. Call your doctor. For an adult, if shortness of breath happens when you exert yourself or even when lying down, when you have a rapid or irregular heartbeat, or you fatigue and get weak easily. These are all signs that you might be having some kind of a heart issue. Some causes. Normally the right side of the heart pumps blood to the lungs to get oxygen. The left side pumps the oxygen-rich blood to the rest of the body. The VSD allows oxygenated blood to mix with the deoxygenated blood, causing increased blood pressure and increased blood flow to the lungs and arteries. The results increase work to the heart and the lungs. VSDs may be various in size. They may be present in several locations of the wall. There may be one or more. It's also possible to acquire a VSD later in life. Normally happens after a heart attack or certain heart procedures. Complications. Heart failure is one of them. In a heart with a medium to large VSD, the heart works harder and the lungs have too much blood pumped in them. Without treatment, heart failure can occur. Also, pulmonary hypertension, which is increased flow to the lungs due to VSD, causes high blood pressure in the large arteries. which can permanently damage them. This complication can cause reversal of the blood flow through the hole. Endocarditis is a heart infection. This is an uncommon complication, and then there's others as well. Prevention. In most cases, you can't do anything to prevent having a baby with VSD. However, there are some things you can do to have a healthy pregnancy. 1, talk with your doctor, discuss lifestyle changes that may need to happen. Make sure that you're taking prenatal vitamins that are rich in folic acids. Make sure that you're exercising regularly inside your doctor's parameters. Make sure that you avoid risks like drugs, tobacco, or alcohol. Stay away from any kind of infections that might injure your baby. And if you're a diabetic, keep your diabetes under control. SE hint.